With school back in session and the average classroom having 30 students, about 1 in 10 are likely to have asthma. And as KENS 5's Jeremy Baker reports, back to school often means back to the doctor because of an annual fall spike in asthma-related illnesses.
Asthma flare-ups and emergency room visits surge significantly among school-aged children within 2 to 4 weeks after returning to school. That seasonal spike is driven by the rapid spread of viral respiratory infections in classrooms.
The most common signs of asthma that we see in children and adults as well is ongoing or recurrent cough, difficulties with breathing, actually hearing wheeze, and or chest pain.
The National Institutes of Health say there are many triggers as kids head back to school, including viral infections, indoor allergens like mold and dust, classroom animals, and even exhaust from a school bus.
We always ask about whether activity, climbing stairs, etc. With allergies, that's a big trigger. Or if you're sick, that could trigger that as well.
The Dell Medical School says asthma accounts for close to 14 million missed school days annually in the U.S. And the National Institutes of Health say asthma is a leading chronic cause of school absenteeism, accounting for 14 to 18% of total student absence in impacted groups. That's why, to prevent complications, the American Lung Association recommends this back-to-school checklist for families with asthma. Schedule a checkup with your child's physician, assess your child's readiness to self-carry medication, meet with the school nurse, talk to your child's teacher, and have an asthma action plan.
The medicines that we give can't make you better than you already are, but the medicines that we give should allow you to be the best that you can be.
To learn more from Dr. Giles about how asthma is diagnosed and treated, we have more with this story on KENS5.com. In the studio, Jeremy Baker, KENS 5.